Andrew, garlic videos make it sound like one jar can lower blood pressure, fix cholesterol, and maybe even reverse plaque. Before anyone orders 3 bottles, what is the honest version? Are we talking about a food habit, a concentrated supplement, or a tiny cardiovascular drug in disguise?
Honest version. Garlic is a chemistry kit, not one molecule. When fresh garlic is crushed, compounds can form allicin and related sulfur molecules. Aged garlic extract is different. It emphasizes more stable compounds, such as S-allylcysteine. Those compounds may influence oxidative stress, inflammation signaling, vascular tone, and lipid handling. But the body is not seeing the same dose from a clove, an oil capsule, and an aged extract tablet. The strongest human evidence is not garlic prevents heart attacks. It is garlic changes several risk markers a little. A large updated meta-analysis of randomized trials found average reductions around 3.7 millimeters of mercury for systolic blood pressure, about 2 for diastolic, roughly 10 milligrams per deciliter for total cholesterol, and about 6 for LDL. Useful? Possibly. Dramatic? No.
So, if someone's LDL is 170, a 6-point average drop is not the rescue boat. But if their blood pressure is borderline and they're already improving diet, sleep, sodium, and exercise, could garlic be one extra nudge rather than the whole plan?
That is the best fit interpretation. Meta-analyses repeatedly suggest bigger or more consistent signals in people starting with unfavorable markers: hypertension, hypercholesterolemia, metabolic syndrome, or cardiometabolic risk. If someone already has excellent blood pressure and lipids, there is less room to move. If someone has high risk numbers, garlic might help at the margins, but it should sit under a clinician-guided prevention plan.
Aged garlic extract gets singled out a lot. Is that because it is genuinely better studied, or because it is easier to market as the right garlic? And do the dose numbers in those trials matter? But supplements are not tested like prescriptions before they hit the shelf, right? If a trial used one aged extract, what should a viewer look for so they are not buying a mystery capsule with a garlic smell?
Yes, dose matters. In a 2024 meta-analysis focused on hypertensive patients, aged garlic extract lowered systolic pressure by about 4 millimeters of mercury, and the authors noted significant effects, especially above 1,200 milligrams per day. Another dose-response review found aged garlic reduced systolic pressure by about 2.5 millimeters and LDL by about 4.4 milligrams per deciliter. That is respectable, but still modest. Garlic also shows signals outside cholesterol. The broad 2026 review found small average improvements in fasting glucose, insulin resistance, C-reactive protein, tumor necrosis factor alpha, and antioxidant markers. A 2024 glucose and lipid meta-analysis reported lower fasting glucose, HbA1c, total cholesterol, and LDL. These are plausible because sulfur compounds may influence oxidative stress and inflammatory tone, but the studies vary enough that we should not oversell precision.
Where's the line between it is garlic and this is a medication conversation? If someone takes blood thinners, has surgery coming up, is pregnant, or already uses blood pressure or diabetes medication, should they ask first?
Food garlic is usually a flavor and diet quality tool first. It can help people enjoy vegetables, legumes, fish, and lower sodium meals. That may matter more than any isolated molecule. But if a person wants the trial-like question, blood pressure or LDL movement, the evidence mostly comes from defined supplemental preparations, not from casually adding a clove to dinner twice a week.
If someone does try a reputable garlic supplement, what counts as a fair test? Are we talking weeks, months, a home blood pressure log, repeat lipids, and then stopping if nothing moves?
Exactly. And the tracking should include safety. Stop and reassess for unusual bruising, bleeding, persistent reflux, nausea, diarrhea, rash, dizziness, or unexpectedly low blood pressure or glucose. Anyone on anticoagulants, antiplatelet drugs, diabetes drugs, antihypertensives, or with a procedure scheduled should coordinate with a clinician rather than self-experimenting in silence. One newer trial in women with PCOS and metabolic syndrome used 500 milligram garlic tablets twice daily for 8 weeks. It reported reductions in fasting glucose, triglycerides, LDL, total cholesterol, C-reactive protein, blood pressure, weight, and BMI, plus quality of life changes. Interesting, but it was short, diet control was limited, and special populations need replication before we generalize.
So the better question is not, is garlic a superfood or a waste? It is, do I have a marker that could plausibly move, a product that resembles studied forms, a safe medication context, and a plan to measure whether the small promise nudge actually happens?
That is the clean summary. Garlic supplements have mixed but real evidence for modest improvements in blood pressure, LDL, total cholesterol, triglycerides, glucose, and inflammatory or oxidative markers, especially when baseline risk is unfavorable. They do not replace statins, antihypertensives, diabetes care, or dietary foundations. Treat garlic as a measurable adjunct. Pick the form carefully, respect the safety context, and let your numbers, not the smell of the capsule, decide.